Introducing the all-new Corolla.
Calvo Select Care Administrator Frank Campillo called the exemption decision a huge win for the territory, saying full application of all the mandates to the territories could have devastated the insurance industry.
For the last 6 months, really, the health insurance marketing for the small groups have been basically shut down because insurance companies were not able to write health insurance on the small group market as a result of some of the applicability of these new guidelines that were applicable effective 1/1/2014. If that had continued, it would have been devastated to the island.
The Affordable Health Care Act, known as Obamacare, had required insurers in the states as well as the territories to comply with costly mandates like providing coverage for those with pre-existing conditions. However, unlike the states, the territories were not eligible for the hefty rebates the states qualified for. Campillo says it appears that at least the pre-existing condition requirement is now exempted for the territories, but it'll take a few days to review the decision and determine just what mandates will and won't apply. The pre-existing condition mandate is lifted.
Correct. So it appears so, but we're going to make sure that we cross our T's and we dot our I's to ensure that we comply with the requirements of the letter.
Although the extent of the exemption is still unclear, it is clear that it's a big victory for the territory, said Campillo. What could have been a disastrous increase in premiums, he said, will now be eased by this decision.
It will open the market again. It will keep insurance affordable. Insurance in the territories is already about 60% cheaper than what it is in the continental United States. And more importantly, it will continue to allow the insurance industry to provide the much needed healthcare coverage to the people of the territories.
However, Campillo cautioned that there are other pressures that will still keep health insurance premiums high.
This may help moderate rates, but that may be offset by some factors that includes increases in medical utilization, increases in specialty drugs, possible increases in our local hospital.
And he also said consumers have become used to some of the mandates required under Obamacare, and insurers may be forced to keep them.
I think that the insurance industry will have to realize that the consumers getting used to some of these benefits, and it is very possible that we may have to keep some of those benefits in our policies.
Kevin Kerrigan, PNC News.